thank you for participating in the Wellness Wave brought to you by ACP Southern California Region 3. My name is Isha Lal. I'm a medical student at UC San Diego, and today I'm honored to be interviewing Dr. Kim. Dr. Kim, can you tell us a little bit about yourself and what you do?
Hi, I'm Sharon Kim. I am a hospitalist at Kaiser San Diego. I'm also the Department Director of Physician Education and Teaching Faculty for the Family Medicine and Emergency Medicine residents. And I'm honored to be here.
Wonderful, we're honored to have you. So, my first question is, how did you choose your career path in medicine?
I think I always knew. My mother was a nurse. I grew up in New York and I did all my training in the East Coast. But I just sort of felt called to medicine. I was exposed to healthcare at a young age. And I've just always been drawn to the humanitarian aspect of caring for people and also the problem solving aspects of internal medicine. So,
Wonderful.
yeah.
And did you always have an interest in physician wellness, or is that something that has come about later in your career?
No, it sort of came about from necessity, really. I was so focused on my career, and I initially had been in academia. I did my residency at Johns Hopkins, and then I came out to UCSF, and then transitioned into GME teaching faculty roles in San Francisco and Portland, Oregon before coming here. And really, it was just this evolution of recognizing that, since I got married and had a family, that I really needed to start focusing on self-care and being present for my family, and realizing that this is just something that, I am learning constantly. So this is more of a recent development that I've been excited to learn how to improve some of these strategies for myself and to teach other people how to do it.
Wonderful. Thanks for sharing that. And do you have any advice for rising medical students and current residents as they're figuring out their path in medicine?
I think just be open and curious, and you'll eventually find your people and whoever connects with you. The subject matter, the patient population, but really kind of the cohort that you really connect with will end up being the right place for you.
Perfect. Thanks for sharing that. So now I'm going to transition to some of the wellness questions. So, our first question is, do you have any advice on how medical students or residents can handle burnout?
Um, I think, certainly this is a very timely question right now in the pandemic, as so many of us are managing with our own feelings of burnout. But that, again, that sense of belonging and connecting with each other, because we are truly in this together. And recognizing that, the weight of the world is not on your own shoulders as the individual, but that you really do have to take care of yourself in order to be fully available and present to care for your patients. So, even if it just means to take half an hour to exercise or to go outside for 10 minutes, to take a study break, and look at the sky, it makes such a huge difference in how you process the rest of your day if you're not kind of in this mindset of um, gosh, this is exhausting and I don't know if I can do this anymore, and that feeling of compassion fatigue. But if you are able to take that time out for yourself and recognize that, um, I can, if I have enough in my tank, I can um, enable the I can enable myself to develop more compassion for those around me. So I think like it's really important to note that you have agency over your own mindset, and whatever it takes um, to kind of reframe that thinking is really, really important. And if it just means that you have to reset to kind of break away from the books for a few minutes, and really think about, well, why am I doing this? Why am I in this field? Is really important.
Yeah, that's such a helpful and great point. I think is like remembering to take some time for yourself and take care of yourself so that you can build yourself up to care for others. So thank you for sharing that. On sort of a similar vein, what is in your wellness toolkit? How do you like to take care of yourself? And do you have any advice for medical students on developing their own personal toolkit?
Um, I think it really is trying to find and think about what brings you joy. For me, if it's a 10-minute dance party with my
Mm.
daughter,
Mhm.
um, right now she really loves Cuckoo Kangaroo.
Oh,
So, we'll do that. But I really enjoy taking high intensity interval training classes and, running outside, and that, even if it's just for a short period of time, it kind of resets and re-energizes me for the rest of the day. Um, so yeah.
yeah, it's always so amazing to me how like exercising for a few minutes seems like it would be so small, but it can have such a huge impact on like your mindset and your overall mood. So, yeah, that's a great point. My
Definitely.
last my last wellness question is related to perfectionism in medicine. Do you have any advice on how to handle perfectionism as like a medical student or a resident and moving forward in our careers?
So this is something that I personally struggle with
Me
a lot.
too.
I think we all do, because that's just how we end up in medicine, right? You are very driven and ambitious, and it's very common to be hard on ourselves. And I think, this is the struggle is with the negative self-talk. But truthfully, to be the best doctors we can be, you have to be in that growth mindset, of curiosity and humility, and recognizing that no one is perfect. We're all human. We all will make mistakes. Um, the important part is to just recognize that, okay, I have learned from my mistake. I'll get it. I'll get it. And, medicine is constantly changing. I mean, it's very different from the practices that I learned 10 years ago. So I have to constantly be asking questions and curious about, okay, well, is this, um, how can I improve my practice a little bit more, but at the same time, like, recognize that, we're all doing the best that we can.
Yeah, that's such a great point, and I love the point of having a growth mindset, so it's still possible to recognize that there are areas that you can improve on, but really talking to yourself in a positive way can make such a big difference, so thank you for sharing that. Is there anything else you wanna share with our viewers before we end this interview?
I think it's just really important to take care of yourselves, because you are our future. You'll be taking care of me and my family,
Mhm.
So really, I I'm so grateful to all of you for focusing on this and taking the time out and recognizing how critical this is to the longevity of our careers. So thank you.
Wonderful. Thank you so much, Dr. Kim. I know I really benefited from this conversation, and I'm sure a lot of students will as well.